Bacterial infections are the most common type of infections that we see in the neonatal intensive care unit. There are several reasons why babies in the neonatal intensive care unit are at risk for infection. The first is that many of those babies are premature, and as a result of that, their immune system is very immature and weakened. Also, the babies are in the hospital for prolonged periods of time and need certain procedures and support devices that actually increase their risk of developing an infection. In the preterm neonatal population, it's somewhere between about 10 and 25% that will develop at least one infection before they leave the neonatal intensive care unit. In the neonatal intensive care unit at Yale, our infection rates are actually quite low. They're more on the order of 5 to 7%. A lot of the success that we've had in infection prevention here at Yale Medicine has really been through a multidisciplinary approach that we've taken to this problem. The infections are treated with antibiotics. The treatments are somewhat different than they are in adults because there are certain antibiotics that we utilize in the adult population that we can't use in newborns because of some of the side effects. I try to reassure parents that the majority of these infections can be treated. I also try to reassure the parents that here at Yale Medicine we have very low infection rates in our neonatal intensive care unit, and that our focus is prevention. One of the more unique approaches here at Yale Medicine is that we have one of the longest running databases on neonatal infections, and it dates back to 1928. And by having this at our disposal, we're able to very quickly identify changes that are taking place, not only in the types of bacteria that cause infection, but also in some of the risk factors for infection in our population that has allowed us to develop programs to more effectively identify and prevent infections. I'm Dr. Matthew Bizzarro. I'm an associate professor of pediatrics in the Division of Neonatology at Yale Medicine.